Hello students, today we'll discuss about the identification of different types of the epithelium in your exam. So whenever you are having the histology slides in your practical exams, this is the most challenging issue with the students, how to identify the different types of the epithelium. So in today's lecture, I will tell you very brief about the theory part of the epithelium, and the major portion in the lecture is related with the identification of the different histology slides. Basically today we will discuss only about the identification of epithelium. So here in these two images you can see that these are such examples of the epithelium, and in today's this session we will try to identify how to differentiate the different types of the epithelium. So let's start the today's session. So my dear students, whenever we are talking about the epithelium, epithelium is a layer of the cell or multi-layer cells which is present either inner side and outer side of the body. That means it is forming the inner lining of the body or outer covering of the body, like skin, which is a covering of the body, and it may present on the inner side of tubular surfaces. So where you will find the epithelium? You will find the epithelium at three places. This is the basic concept which you always keep in mind, that this is your body and this is a tube inside the body, like your gut tube. So where you will find the epithelium? Epithelium is present on the inner side of this tube. Epithelium is present on the inner side of the body, and epithelium is present on the outer side of the body. Clear? So epithelium is forming the covering, lining, and this is also known as lining. Clear? So we will see the epithelium, which is a layer of cells which is present on the basement membrane, and that is actually known as epithelium. So where you will search the epithelium? We will search the epithelium at these three places in the body. Now the epithelium is a basic tissue of the body that consists of the tightly adherent cells which are called as epithelial cells. That means when you will see the two cells, these two cells are having some material, and that material keep the two cells to remain adherent to each other. And these are the basic tissue. You know that there are four basic tissue in the body. What these four basic tissue in the body? You know that one is the epithelium, which we are reading today. Second thing is your muscular tissue. Then you will have the connective tissue, and the fourth one is nervous tissue. Clear? So these are the four basic tissue. Out of the four, today we are discussing the epithelium. So how will you classify the epithelium? In very short, I am just explaining this, that epithelium is of two base classification on the basis of layer and the shape. Now when you will talk about the layer, you are having the simple epithelium. That means the cells are present on the basement membrane and there is a single layer of the cell. If the layer is more than one, that means there is a one cell layer and there is a one more cell layer, then it is known as stratified. It can be 2, 3, 4, 5, but there has to be minimum 2 layer. If it is more than 2, then it is become stratified. If it is a single layer, then it is known as simple epithelium. So one layer of cells is known as simple epithelium. Two or more layer of cells, stratified epithelium. Now there is a one more spatial epithelium on the basis of layer, which is actually a type of simple epithelium, but it appears like a two-layer structure. That's why it is known as pseudo-stratified. So pseudo-stratified is not a true stratified, it is a simple epithelium basically. So here the question comes is, how to define a epithelium is a single or multi-layered? So my dear students, the only answer which you have to keep in mind is on the basis of nuclei, because when you are seeing the slides, we are basically concentrating on the layer of nuclei. So please keep this thing in mind. In the bold letter, it has to be there in your mind that whenever we are tracing the layers, we are actually talking about the layers of the nuclei. So suppose it is a simple epithelium, how it looks like in your exam. So if it is a simple epithelium, you will find a single layer of nuclei. Now if I am able to see the single layer of nuclei, that means I am dealing with a one layer of the cell and I will label it as a simple epithelium. But suppose if I am having the two layers of your nuclei. So you are having one layer of the nuclei and you are also able to see one more layer of nuclei. So here I am able to see the two layers of nuclei. It may be more than two, it may be three layer of nuclei, it may be four layer of nuclei. So now it is showing that you are having one layer, two layer, three layer, four layer of the cells. So because there are four layer of the cells, they are known as stratified epithelium. Here you are having single layer of the nuclei, that means you are having a single layer of the cell, that means it is a simple epithelium. But what is happening in the pseudo-stratified, you are able to appreciate the one more layer of the cell. And the cells are short, so you will find two layer of the nuclei here. Now just by seeing the layers of the nuclei, it is giving the appearance that there are two layers of the nuclei. But when you will analyze the cells, you will realize all the cells are present on the basement membrane. How they are present on the basement membrane? You will realize that this is a longer cell, this is a short cell, this is a longer cell, this is a short cell, this is a longer cell, short cell, longer cell. So in such a way, you are able to understand that every cell is actually attached on this basement membrane, but the height of the cells are different. That's why the nuclei are placed at two level. So my dear students, what is the concept right now should come in your mind, that whenever I try to identify any epithelium, my main aim is to check the nuclei. If you are dealing with a single layer of the nuclei, you are dealing with a simple epithelium. If you are dealing with more than one layer of the nuclei, you are dealing with the stratified epithelium. But there is an exception where you are dealing with the two layer of the nuclei, and that is pseudo-stratified because all cells are present on the basement membrane and the height of the cell is different. Clear? So that is the pseudo-stratified epithelium. Now, so how you will classify on the basis of the shape of the cell? We have classified in the three type. One is known as squamous, then you will have the cuboidal and the columnar. So again, the question comes is that how to differentiate these three epithelium? The only answer is on the basis of the nuclei. Because the shape of the cells are defined, but in some cases we are not able to appreciate the shape of the cells. So we have to concentrate basically on the nuclei again. Now theoretically, you know that the squamous cells are the flat cells. They are the flat cells. And if you will see the nuclei is there and this nuclei is elongated and flat. So you will find the flat and elongated nuclei. Clear? Now when you are having the simple cuboidal, what you are able to understand that in simple cuboidal, your cell is having the equal height and width. And nuclei is round and this round nuclei is centrally placed. And when you will see the third variety, that is the simple columnar, you know that the nuclei is elongated nuclei. Cell is also elongated, that means the height is very much as compared to the width. And if you will see the cell, the nuclei is again elongated, but it is vertically oriented oval shaped nuclei, which is generally present in the lower part of the cell. So these are the three different orientation of the nuclei. Now suppose if you are having a epithelium, now this is the basement membrane and you will find that this is the basement membrane, and on this basement membrane I am having the flat nuclei which are arranged like this. Now label the epithelium. Now on the basis of the nuclei you can see that it is now labeled as a simple squamous epithelium. But suppose rather than having this type of the epithelium, you are having a basement membrane and then you are having the nuclei which are round. Now tell me the epithelium. Answer is simple cuboidal epithelium. Suppose you are having such nuclei, then what is the epithelium? It is a simple columnar epithelium. So my dear students, you can see that only just by seeing the single layer of the nuclei shape, you can very well tell the name of the epithelium. And the only thing which you have to keep in mind that we are talking about a single layer of the nuclei. So if it is a single layer and you are having all the round nuclei, cuboidal, all the elongated vertically oriented nuclei, columnar, and all the flat horizontally placed nuclei, simple squamous epithelium. Now, what are the examples of simple squamous epithelium? If you will open the book, there is a long list of the simple squamous epithelium. For example, you are having the lung alveoli where you will have the filtration, endothelium, endocardium, mesothelium, then you will have the parietal cells of the Bowman's capsule in the kidney. So these all are the examples of simple squamous epithelium. So we'll try to identify these epithelium at 2 or 3 examples. Then you will have simple cuboidal. You know that cuboidal epithelium is in the thyroid follicles. Then you will find them in the smaller ducts of the exocrine glands. Then the ovary. Now when you will see the ovary, the outer surface of ovary is lined by the simple cuboidal epithelium, which is known as germinal epithelium. Now here you will have a question that it is a misnomer. Why it is a misnomer? Because this simple cuboidal epithelium is not going to produce any kind of germ cells. So it is a wrongly used word for this lining. It is not a true germinal epithelium. Then you will have the simple cuboidal epithelium in choroid plexus. In the lens, you will have pigmented cells in the retina. Then you will have ducts of Bartholin and some part of the tubules of the kidney like DCT. Clear? Then you will have a list of the examples of simple columnar epithelium like you will have in the gallbladder, you will have in the stomach, you will have in the intestine. Then you will have the lining epithelium of the uterus. Here, if sometimes you have the ciliated simple columnar, then there is a long list again. Now, my dear students, here I will add one more basic concept that whenever you are talking about any surface modification like cilia, like microvilli, now you have to keep this thing in mind that these all modifications are always a feature of simple epithelium. If you are saying that there is a epithelium which is stratified with cilia, it is a wrong answer. There is nothing like ciliated stratified epithelium. Always the cilia and microvilli are the feature of simple epithelium. So ciliated columnar epithelium means we are talking about one layer of the cell, that means simple layer. Clear? So this is a concept that you never use the cilia and microvilli or brush border with stratified epithelium. If you are using the word stratified, there are no surface modification. Simple epithelium always shows the surface modifications. Now, when you will see the stratified, you know that stratified epithelium means the multilayered, but the layer name is the top layer, which is actually the output. That means if the top layer are flat, we will use the squamous epithelium. If top layer cells nuclei are having the round, that means it is a stratified cuboidal, and if top cells are having the elongated nuclei, that means it is a stratified columnar. So name is given only on the basis of the top cells, and you will find that the basal cell layer rests on the basal lamina, and the classification is given on the basis of the shape of the cell in the top layer or the superficial layer of the epithelium. And you know, stratified is again of three types: stratified columnar, stratified squamous, and stratified cuboidal. Now, when you will see the stratified cuboidal, again you have to keep this thing in mind. In most of the cases, the stratified cuboidal and stratified columnar epitheliums are, in most 90% cases, they are double layer. They are not more than double layer. That means, in these images, you can see that the basal layer, this is the basal layer and this is the basal layer. Now, you will find that the basal layer is of similar shape. The nuclei are round here and nuclei are round here. But when you will see the superficial layer, that means this top layer, you will make the difference that the top layer is having the two different identification. Here the top layer cells are round, here the top layer are elongated. That's why it is known as stratified columnar, it is known as stratified cuboidal. So, the name is given only on the basis of the top layer, not on the bottom layer. And in case of stratified cuboidal and stratified columnar, they are generally two layers, not more than two. So, this is a one concept which you always keep in mind. Now, there is a one more special type of epithelium which is known as transitional epithelium. So, transitional epithelium is also a special stratified epithelium. Now, in the transitional epithelium, you have a special character of transition. That means, this epithelium has the ability of distension, and this epithelium present in the urinary tract. That's why it is also known as urothelium. And what is the cell thickness? Now, this is a question of your exam. So, in empty bladder, it is 5 to 6 layer thick. But when the stretching occurs in a full bladder, the epithelium will become 2 to 3 cell layer thick. Clear? So, transitional epithelium is again a stratified epithelium. It is having 2 to 3 cell layer when it is stretched. It is having 5 to 6 layer when it is relaxed. So, this is the one thing. The second and most important identification here is that the cells of the most superficial layer are dome shape. Now, this is a question, dome shape or umbrella shape. Second thing is that the sum of the cells may have the two nuclei. Binucleated cells may be present, and this binucleated cells in the epithelium with umbrella shape is a classical feature of your transitional epithelium. So, now we have completed the theory part. Now, we will discuss identification one by one. Now, this is your first slide. Now, suppose I am having this slide in the exam and I have to identify the epithelium. So, my dear students, here you have to keep the patience in your mind, and with the careful monitoring, if you will see this slide, what you are able to understand here, that you can see the flat nuclei. Now, this is the one flat nuclei. I hope you are able to see here. You can see this is a flat nuclei again. Clear? So, what is the flat nuclei? I already explained you that flat nuclei are present in the squamous epithelium. So, my dear students, it is an example of squamous epithelium. So, how I am able to identify this? I am not concentrating on the shape of the cell. You have already learned that the shape of the cell is elongated, but we are not concerned with the shape. Shape is not visible generally. We are always concerned with the shape of nuclei. So, here I am able to understand that if I will trace the shape of the nuclei is the flat nuclei. You can appreciate the flat nuclei. If you will see here also, you will find this is a flat nuclei, this is a flat nuclei, this is a flat nuclei. So, this flat nuclei appearance is a classical appearance of simple squamous epithelium. Now, you may tell me, you may ask this question, why it is not stratified? My dear students, if you will see the stratified epithelium I already told you that in stratified epithelium, the name is given on the basis of the top cell and there is a presence of multiple layer of nuclei, which we will see in the coming slide. Then you are able to differentiate. It is not stratified, because if it is stratified, then you will have multiple nuclei in very close vicinity of this. You are not having the nuclei in the close vicinity. You are having the nuclei which are quite far away. So this is not the stratified epithelium. This is the top cell which are flat, and these flat cells are simple squamous, and there is no other nuclei present in the vicinity of these flat cells. So it is not stratified, it is a simple squamous epithelium. Now here, if you will see this slide. Now in this slide, again you try to identify the slide, and this slide is again having the simple squamous epithelium. You can see these flat nuclei which are very flat, dark purple color. You can appreciate this one, you can appreciate here also. So your eye has to be trained to identify these different flat nuclei, and these flat nuclei are your simple squamous epithelium. Now let's see this another slide. Now in this slide, what you are able to understand, that you will find a single layer, again it is a simple epithelium. Now if you will see the shape of these nuclei, you are able to see that these are almost round. They are round. And here in this particular epithelium, you can also able to appreciate the height, or you can say the size of the cell. So what you are able to understand, that this is the size of the cell also. So you are able to appreciate that these are the cuboidal cells which are having a single layer of round nuclei. So what is this? This is a simple cuboidal epithelium, and right now this is a slide of the ovary. So this is a germinal epithelium. So suppose if you are having a slide of the ovary in your exam, and you have to trace the epithelium, you have to come out on the outer surface of the ovary where you are having this simple cuboidal epithelium, and this simple cuboidal epithelium here is known as germinal epithelium. Now this is another example of identification of the epithelium. Now my dear students, in this what you are able to see is, this is a lumen of a duct. Now in this duct, if you will see this wall, here you are able to see the classical round nuclei. So again, I am saying this, what is the main purpose is to check the shape of nuclei. So what is the shape of nuclei? They all are almost round. So what is this? We are dealing with the cuboidal epithelium. So you should first make this concept clear in your mind, that whenever you are identifying the epithelium, we always going to identify the shape of the nuclei. If they are flat, then it is a squamous. They are circular, then it is a cuboidal. If they are elongated, then it is a columnar. So here you can see that it is a one layer of this epithelium. So what is this? It is a simple cuboidal epithelium, and these are the ducts in the salivary glands. Now this is again a one more duct in a salivary gland. You can see that these are the serous acini, and in this gland you can see this is a duct where you are able to appreciate again a single layer of the cuboidal cells, and this is again a simple cuboidal epithelium lining the smaller ducts of salivary glands. So again you have to concentrate on the shape of your nuclei of the cells. Now in this video, let's start the video and we will try to identify the nuclei, how to focus. So suppose I am having this slide of a gland. Now I first focus this duct. Now when I focus this duct, I make it enlarge, and when I enlarge it, what I am able to find, that there are presence of the nuclei, and I have to check the shape of these nuclei. So what is the shape of these nuclei? You can see there are round nuclei, but they are two layer now. there are two layers. Now you can see this is a one layer and this is another layer. So is it a simple epithelium? No, it is a stratified epithelium. What is the shape of the top layer? The top layers are round, so it is labeled as a stratified cuboidal epithelium. Clear? Now this is another example of the identification of epithelium. Suppose you are having this slide in your exam. So what you have to do is, you have to check the epithelium here. So you just make it under the 10x. Now once you are having the 10x, focus this one of the area and now see under the high power. Now this is a slide of the thyroid gland, and you know that we already learned this example that thyroid gland follicles lined by the simple cuboidal epithelium. So let's check that is the epithelium is cuboidal or not. So here if you will see, you will find that again the cells are round. They are round enough, and these round cells are the classical feature of thyroid follicles. So if you will see the slide, if you will rotate the slide, you will find at multiple places these cells are round. So my dear students, if you are having the epithelium like this, now there should be no confusion. They are not flat cells. They are not flat cells. If they are flat cells, it has to be the squamous. Is it an elongated cell? No. If they are elongated cell, then the appearance will be like this. So is it the same? Is it the appearance? No. So when the cells are not elongated, when the cells are not flat, what left is the cuboidal epithelium. Clear? So this is a very basic concept when you are identifying the slides and when you are trying to check the epithelium. You should keep this thing in mind that if I am labeling it as a columnar, then the cell should come like this. But here in this slide, the cells are not coming like this. The cells are like this. And they are not flat. The flat cells are just like this, a line. They are not appear more than a line. So this is a basic difference between the squamous, columnar and cuboidal. So right now you are dealing with the epithelium which is having the round cells and these nuclei, and these round nuclei is a classical feature of cuboidal epithelium. Now here I try to explain you one more example of simple squamous epithelium. Now in this diagram, this is a black and white shadow or the diagram of your kidney. Now in the kidney you have the Bowman's capsule, and the lining of Bowman's capsule is simple squamous epithelium. So here you can see that these are the cells which are lining the Bowman's capsule, and here again you can see that the cell thickness is not more than a line. So if very carefully, if you will examine this inner line, now here also you can see this, you will find that these cells are flat. So you have to train your eyes that what is the meaning of flat cells, what is the meaning of circular nuclei and elongated nuclei. So once you are able to identify these flat nuclei, automatically you are able to understand that it is a simple squamous epithelium. So let's see this identification of the epithelium. So this is what is the slide of the kidney. Now once you are able to understand the cortex and medulla, you come in the cortex. In the cortex you will find multiple areas of Bowman's capsule. So focus one of the Bowman's capsule and try to check this inner lining. Now here in this image also you can very well appreciate these flat nuclei. So these flat nuclei are lining the inner side of this Bowman's capsule, and here also you can see this is a flat nuclei, this is a one more flat nuclei. So these nuclei are all your simple squamous epithelium. So my dear students, the simple squamous epithelium is a epithelium which is having a very flat nuclei. Now this is a one more example of the epithelium. Now in this example, I am able to see that nuclei are now elongatedly placed. Now these are the position of nuclei. So we have the three shape of the nuclei, this single line of nuclei, circular nuclei and this shape of elongated nuclei. So right now you are dealing with which shape? This one. So this is a columnar epithelium, this is a cuboidal, and this is a squamous. So now here you can see the nuclei are elongated. So we are right now dealing with which type of the epithelium? Answer is columnar. And if you will see the columnar epithelium here, you will find that there is a single layer of the cell, and here you are able to appreciate a single layer of the elongated nuclei. So you are dealing with a simple columnar epithelium. So this is a simple columnar epithelium. It is not stratified because there is a single layer of the cells only. The nuclei is elongated, so it is a columnar epithelium. Now here also you can see the epithelium. It is a slide of the fallopian tube where you are having the mucosal folds, and in this mucosal fold again if you will see, the cell thickness is a single layer cell thickness. And in this cell thickness, if you will see very carefully, you will find the elongated nuclei are present. So it is again an example, but here there is one more additional feature, that on the top you will find these threads, and that thread has to be identified very carefully. And these threads which are appearing here in a pink color area, now these threads are cilia. So this is a ciliated epithelium of your fallopian tube. Now this is one more slide of your simple columnar epithelium. So suppose I am having this slide in the exam. So I first focus under the 5x or the 4x. So I just first find out the place where I have to identify any nuclei. Then I will focus, or I will change it to the 10x, and then finally I will go on the 40x. So this is my sincere suggestion. Please try to identify the slides in the 10x only. So once you will rotate this slide completely, you are able to understand that we have to check the epithelium on this part. So once you are sure about where the epithelium is present, that is the lining or the covering. So here I just change the lens. Now I am dealing with the 10x. Now in the 10x, I will find there is a line of the nuclei is present. Now to check the shape of the cell, is it a flat, circular or elongated, I move the lens to the 40x, and now if you will focus these nuclei, you will find they are elongated nuclei. So elongated nuclei are present here, and these elongated nuclei, which is a single layer cell. Now you can see it is a single layer cell, and these elongated nuclei is simple columnar epithelium. So my dear friends, you have to keep this practice in your practical labs, that whenever you are having the slide, you first always keep this thing in your mind, that is it a simple epithelium or stratified? If it is a simple, then let's check the shape of nuclei. So here you will find this is a elongated nuclei. Now in this particular epithelium, you are able to see the light color areas. Now these light color areas are actually the areas which are having the goblet cells. They are goblet cells, and you know that goblet cells are mucus secreting cells. So it is a epithelium of your intestine, and in the intestine you are having large number of the goblet cells, that is mucus secreting cells. Now this is one more epithelium. Now this epithelium, if you will see the nuclei, what is the layer? Now let's check the layer. Now this is a one nuclei, this is another nuclei, this is a one more, this is one more, this is one more. So you will find there is a multiple layer of the nuclei. That means you are dealing with the stratified epithelium. So from this base to the top, this is a thickness of the epithelium. And my dear students, most of the time you have to keep this thing in mind. If your epithelium is 2 layer thick, most of the time it is stratified cuboidal or columnar. In most of the time, in most of the slides, the stratified cuboidal and columnars are not more than 2 cell layer thick. But if you are seeing a cell thickness of more than 2 layer, then there are two chances. It can be the transitional epithelium or it can be stratified squamous epithelium. This is one of the most common findings which we are having. Now, in this slide, you are not having the two layer, so it cannot be the stratified cuboidal and columnar. Transitional epithelium is having very specific orientation and the identifying feature that we will discuss in the coming slide. So, it is not the transitional. So, what left is stratified squamous. So, stratified squamous epitheliums are generally having 8, 10, 9 layers of the nuclei. In this slide also you can see there is a large number of the thickness of the nuclei. Now, if you will see again the top cells and the bottom cells, what you are able to understand here, that the top cells are flat, these cells are flat. So, on the basis of the top cell, we are giving it the squamous epithelium. If you will see the basal cells are cuboidal, or you can say they are columnar. They are not horizontally placed, they are not flat, they are vertically lined. But we are not giving the name of this epithelium on the basis of basal cell. We are giving the name to this epithelium on the basis of top cells. So, it is a stratified squamous epithelium. Now, this is a classical example of a stratified squamous epithelium, that is the skin. Again, you can see that the cell layer is a thick cell layer is there, and on the top you are having a homogeneous pink color area which is not having the cell, it is a keratin. So, right now we are dealing with the keratinized stratified squamous epithelium. So, again, what is the concept? How I am able to identify this? Is it a single layer or more than one layer? So, it is a more than one layer nuclei which I can see here. So, we are not dealing with the simple epithelium. Now, I am dealing with the stratified epithelium. Now, I am having four options in the stratified squamous, cuboidal, columnar and transitional. Is it a transitional epithelium? No, it is not a transitional epithelium. Why? Because I will explain in the coming slide, it is having some special characteristic and it is easy to identify. Now, we will deal with the three. Now, I just told you that simple columnar and simple cuboidal epitheliums are generally having the two layer of the cell. Now, here it is more than two. You can very well appreciate that the nuclei are more than two layer. So, what left is the stratified squamous. So, you are dealing with the stratified squamous epithelium, and this epithelium is having a thick pink color homogeneous layer. This is keratin. So, it is a keratinized stratified squamous epithelium. So, this is a classical example which you will find on the skin. So, when you will have the slide of the skin, what you have to done is, first again our first job is to check where is the epithelium under the thorax. Once you are sure that this is the epithelium on the skin, you just move the slide to the 10x. Now, in the 10x, you will find that it is a more than one layer, so it is stratified, but the layers are more than two in number. So, it is not a columnar, it is not a cuboidal, and it is lined by a thick homogeneous pink material. So, you are dealing with a keratinized stratified squamous epithelium. Now, we will move to this slide. Now, this is one more example. Now, suppose you are having this slide. Again, the question is what type of epithelium it is. Now, after explaining this again and again, it should be very clear in your mind that here you are dealing with this much of thickness. Now, in this thickness of the slide, you will very well understood now that it is very clear in your mind now that this thickness is not a two cell layer thickness, it is more than two cell layer thickness. So, we are not dealing with the simple cuboidal, we are not dealing with the simple columnar, we are not dealing with the stratified cuboidal, we are not dealing with the stratified columnar. So, what left is stratified squamous, and this is a stratified squamous epithelium where you will find multi-layer of the nuclei, and you can see the nuclei thickness or the epithelial thickness from here to here. So, my dear students, whenever you are having the histology slides in your practical exam, you should first make sure that what type of epithelium you are dealing with, because it will make the sense, or it will make easy to identify the organ. Suppose you are having the stratified squamous epithelium, You cannot deal with the stomach, you cannot have the gallbladder, you cannot have the intestine, you cannot have your colon. So once you are having the idea of the epithelium, you can correlate with the organ also, that what type of organ you are dealing on the basis of the epithelium. So this is what is the thickness of your epithelium here. So what is, it is a stratified squamous. But here you don't have that thick pink color material, so it is a non-keratinized stratified squamous epithelium. Now this is again the epithelium which I have to identify. Now let's talk about the layer. Is it a simple or stratified? So when I have this epithelium, I was able to understand that there are multi-layer of the nuclei, 1, 2, 3, 4, 5, 6. So it is a simple? No, it is a stratified. Now in the stratified, again you are having the 4 options: stratified squamous, columnar, cuboidal and transitional. Now I told you that in cuboidal and columnar generally you are having the 2 layer, so it is a 2 layer? No. So now we are having only the 2 options, stratified squamous and transitional. Now in transitional epithelium, the top cells are dome shape, or you can say umbrella shape. So if you will see the lining of the outer most covering, you will find that the shape of the cell is umbrella shape. You will find such curvatures, and this is a classical feature of your transitional epithelium. Because in squamous, this is a flat type of pattern because the cells are elongated. Cells are elongated. So they are not producing the dome. But here, there is a presence of this classical elevation or the dome, and this is the transitional epithelium. So my dear friends, this is a very important identifying feature with the transitional epithelium, that the epithelium is again multi-layered, it is stratified, but the top cells are not flat, they are having this kind of projections which is known as dome or umbrella shaped cells. So it is a transitional epithelium. So let's see the slide of urinary bladder. Suppose I am having this slide in the exam. So first I have to check where is the epithelium. So I will find that there are multiple nuclei are present here. So once you are go through the 5x and the 10x, now move it to the 40x to identify. Now when you will move to the 40x, you will find the top cells are now showing this kind of the projections from the surface. That means you are dealing with the dome shaped cells, and I just told you that dome shaped cells is a feature of your transitional epithelium. So my dear friends, this is a dome shaped classical appearance. You can see the cells are having this type of the bulging, and this bulging is a characteristic feature of the slide of urinary bladder or ureter, that is you are dealing with the urothelium or transitional epithelium. This is one more slide. Now in this slide, I tried to explain you how the epithelium changed from 1 to 2nd. Now see, this is the layer where you can see that the nuclei are present here in the bottom of the cell. And if you will trace this epithelium, it is approaching up to here. But suddenly here you are able to see the thickness of the epithelium increases. That means we are dealing a part of the body where the epithelium is showing the transition. And this transitional area, right now you are dealing with the junction of the lower end of esophagus and the upper part of stomach. That means cardio-esophageal junction. So at the cardio-esophageal junction, what is happening, that this squamous epithelium, which is stratified squamous epithelium, is changing to the simple columnar epithelium. But my purpose is to show you the 2 different epithelium in single eye vision, that how the epitheliums are different from each other. So sometimes you may have the 2 epithelium in one part, then you should keep this thing in mind that you are dealing with some junctional areas. Clear? So this is a junctional area where you can very well appreciate that it is a stratified epithelium which converted into a single nuclear cell layer, that is a simple epithelium. Clear? So this is an enlarged view of this junction. Now in this enlarged view, if you will see very carefully, you will find that these are the elongated nuclei. So these elongated nuclei are known as columnar epithelium. Here you can see the thickness of the epithelium. You are having multi-layer epithelium. So what is this multi-layer epithelium? This is a multi-layer epithelium of your lower end of esophagus. This is a upper part of cardiac end. So it is a cardio-esophageal junction where you are having the change on the epithelium. Clear? So that is what is the important thing to understand. This is again the cardio-esophageal junction. So now in this one single slide, I try to again revise the different epitheliums. So what is this? It is a multi-layer, and in this multi-layer, what you are able to understand that there is a homogeneous pink color outer layer, and this multi-layer epithelium is there. So it is now labeled as a keratinized stratified squamous epithelium. Here you will see the epithelium is again thick multi-layer of the nuclei, but there is no keratin which is present here. So it is a non-keratinized stratified squamous epithelium. Now here, if you will see the top cells are flat. You can see these are the flat nuclei. So what is this? Simple squamous epithelium. So now you can differentiate, it is a simple, it is a stratified. So there should be no confusion that it is a stratified. It is not a stratified. This is the pattern of a stratified epithelium. Now this is the top cells which are dome shape, and it is stratified. So what is this? Transitional epithelium. Here you can see the cells are present in a single layer, but the nuclei are vertically oriented. It is a columnar epithelium. And here you can see that nuclei are single layered, but they are circular in shape. So it is a simple cuboidal epithelium. So now at the end of this session, I hope you are having the idea how to identify the simple squamous, simple cuboidal, simple columnar, stratified cuboidal, stratified columnar, and stratified squamous epithelium. And the most important thing is that the transitional epithelium is a stratified one, but the top cells are dome shaped. So by this idea, I think it will give you a brief knowledge about the identification of epithelium, and it will definitely help you in your practical examination. So this is all for the session. Thank you.